Bismillahir Rahmanir Rahim. Assalamu alaikum. I am Professor Adam Ahmad Adam. You are welcome to this bacteriology lecture. It is about Haemophilus influenzae. This bacterium is gram-negative Coccobacillus and it is facultative anaerobe. Some strains of this bacterium are encapsulated and therefore typable by the capsular antigens into 6 types A, B, C, D, E, and F. Other strains are not encapsulated, known as non-typable. The infection takes place by inhalation of the respiratory droplets during coughing and sneezing, and also direct contact, person-to-person contact. The incubation period ranges from 2 to 4 days. Untreated patients remain infectious even after disappearance of symptoms. They remain as asymptomatic carriers in the nasopharynx. They carry the bacterium asymptomatically in their nasopharynx. Haemophilus influenzae type B causes the vast majority of cases and the diseases. It causes bacteremia, pneumonia, epiglottitis, infection of the epiglottis, an acute infection which may lead to fatal airway obstruction. Also, it causes acute bacterial meningitis in infants and young children. Haemophilus influenzae can affect any age, but the commonest group are children. The peak occurrence is 6 to 11 months of age of children. Most children acquire immunity by the age of 5 to 6 years. Occasionally, Haemophilus influenzae causes cellulitis, osteomyelitis, which is an infection of bone, and infectious arthritis. Diagnosis, clinical, and their laboratory investigation. The specimens to be collected depend on the clinical disease. So these may be sputum, CSF, blood, and so on. The bacterium grows in chocolate agar with added X-hemin and V nicotinamide adenine dinucleotide factors. These X and V factors are important for its growth. The bacterium is fastidious, that's say exacting in their nutrient requirements. And it can grow aerobically or anaerobically, but the atmosphere rich in carbon dioxide is the best for it. It grows in blood agar in the hemolytic zone of Staphylococcus aureus in a phenomenon known as satellitism. If they are cultured together in blood agar, Staphylococcus aureus will lead to hemolysis of red blood cell, releasing V factor, and Haemophilus influenzae will grow bigger in the hemolytic zone because it finds the V factor. Now you look here. And therefore, the colonies of Haemophilus influenzae become bigger when they grow in the zone of hemolysis of Staphylococcus aureus. This phenomenon, as I have just said, is known as satellitism. Haemophilus influenzae is catalase and oxidase positive. Latex agglutination, particle agglutination, antigen antibody reaction is used in its diagnosis. Treatment, third generation cephalosporins such as cefotaxime, and ceftriaxone are used. Other drugs of fluoroquinolones and also macrolides and other drugs are used in treatment. Prevention by vaccination. The vaccine is a polysaccharide conjugated vaccine, conjugated with protein to make it potent. Booster dose is needed to augment, to support the vaccine. The non-typable Haemophilus influenzae cause mucosal infections such as otitis media, sinusitis, conjunctivitis, and exacerbation of chronic obstructive lung disease. By this, the lecture is over. I hope that it is understandable and I wish you all the best.